Hi, this is Dr. Walker from DentalWalker.com. Welcome back to the channel. Before we get too far in this video, if you like what we're talking about, go ahead and hit that like button for me so we can continue doing some of these videos for you. So today I'll talk a little about osteoporosis, osteopenia. So bone loss, bone breakdown, that sort of stuff. So a lot of folks will, and especially postmenopausal patients, will see the doctor, and the doctor will do what they call a Dexa scan on them. And the Dexa scan will say that their bone mineral density is not essentially high enough. And so what they will then do is they'll put these patients on one of several things. They give them a calcium carbonate pill, or they give them Fosmax or Boniva, one of those things. And as I said before, calcium carbonate by itself, especially when you're taking things like 1,000 or 1,500 milligrams of these things, a lot of it will get deposited, for example, in your blood vessels and tissues, increasing risk for heart disease and heart attacks and so forth. And in fact, Fosmax and Boniva, some association as well with esophageal cancer. My thought is never to do that. My thought is never to first just go straight from, quote, getting a Dexa scan to it's showing you that you have osteoporosis, osteopenia, and then to take one of those things essentially by themselves. And some of the calcium carbonate pills by themselves will not have, in my opinion, the important thing that helped to increase the absorption of the calcium for you. D3, no association, it doesn't have that associated with it, or K2, not associated with that at all. And believe me, there's more to your bone mineral density, more than just calcium, right? So the first thing I probably will do is essentially I would look at your magnesium levels, one, and look at your D3 levels, your vitamin D levels as well, because if your vitamin, and many of them don't do that. Many of them do not check your vitamin levels to be certain that, vitamin D levels to be certain that they're adequate enough to increase your calcium absorption. They don't necessarily do that, right? They go straight from essentially getting your Dexa scan to saying, okay, you need to have this test, as opposed to seeing exactly what sort of things you're missing or depleted in before starting on one of these things. So if they do a Dexa scan and the Dexa scans you osteopenic or osteoporotic, again, before you start one of those pills, ask them to double check your magnesium levels and ask them double check your vitamin D levels, because I suspect both of those or one of those would be low, right? And 20 nanograms per milliliter is not what I think most folks should be. I think most folks should be above 60 nanograms in terms of vitamin D levels, above 60 nanograms per deciliter for their vitamin D levels. So that's what I would do. Get my magnesium levels checked, get my D3 levels checked, and obviously you need to get the K2 as well in your diet. Now, once you have your magnesium levels being normalized, and your vitamin D3 levels normalized, and you're taking K2, so those three things. So for men, it's 400 milligrams of magnesium. For women, it's about 320 milligrams of magnesium. And again, your D3 levels should be above 60 nanograms per milliliter for you to be normalized. Now, once you have those things in place, then you look at the kind of foods you're eating, right? To increase your calcium levels, you need to be on things like goat's milk or feta or green leafy vegetables, spinach, broccoli, any of those things. Moringa is another one. Those things have high calcium levels. And again, so the D3 is going to pull the calcium from your gut, put it into your blood. Then the K2 is going to take it from the blood and deposit where it needs to be in your bones, and not in your tissues. Magnesium, as I said before, magnesium really is one of those things that's going to activate those D3 receptors, and vitamin D receptors are essentially on every cell of the body. So unless your magnesium levels is adequate, in other words, you have enough keys to open those doors, the vitamin D doors essentially, it doesn't make a difference how high your vitamin D levels are. If your magnesium levels are low, it's not going to work. So you need both. You need the magnesium, you need all three. You need magnesium, the D3, the K2, and then you need some of those good foods. Now, if you've done that for 6 months or a year and your levels aren't going up, then there may be another discussion in terms of what other supplements can add to your list. But I would start there first to be certain that those things are adequate, and if they're adequate, your levels should come up normally. Now, if you're postmenopausal, yes, it may be more challenging for you because there's lots of osteoclastic processes happening from that standpoint when your estrogen levels are too low. But still, just the basics need to be done and checked first to be certain that you have the tools that you need to make your bone mineral density normalized, and you're having the foods that you need to do that as well. Anyway, thanks for listening, Dr. Walker. Have a great time.